Good evening and welcome back to a new session of Your Health Today with Dr. Soliman. Today we're going to talk about something that is very interesting, and it's a problem for a lot of people out there, especially families. We will be talking about drug abuse and addiction. So that's, it's a very important thing, and most of the families, not only in Cameroon, but also everywhere else, are subject to this issue. At one point of their life, one member of their family. So if we start, please, with the video, we'll show you one of my patients that have came in acute intoxication, and then we'll discuss at length what happened and how did we deal with it. What do you see? What do you see? What do you see? Come on, why are you fighting me? Calm down. Calm down. What do you see? If we don't flush him, then we'll have to drain him. He has to take the medication. This is all intoxication.
Yeah.
This is intoxication with what substance, we don't know. Most likely it's crack. Calm down, boy. Calm down. Calm down. Calm down. Calm down. Did you really feel that?
Yeah. Yes.
So this patient came in. He was very aggressive. This is when we took him up to the floor, upstairs. When he came in, he was very aggressive. Nobody can touch him. Nobody can hold him. Nobody can talk to him. He's fighting his own father. Doesn't know who is, dealing with. The only person that maybe can sit next to him and he does not fight was his mother. Beside that, he was aggressive to everybody, nurses, my young doctors, everybody on the floor. When he came in, he was aggressive too. As you see, he came in, the family is, low socioeconomic class, meaning they are farmers. They are nothing to, they are from the lowest socioeconomic class. So when the son turned into using something like that, it's a disaster, because as you see, the whole family is there. So that's the financial strains, emotional strains, a lot of stress, that this boy put his family into because of what he's taking. Now, with substance abuse, we call substance abuse because you are not taking it as you're supposed to, like prescribed by a doctor or something, but you're abusing the substance. This substance could be anything, starting from alcohol to heroin to cocaine. They have different names. We have LCD. We have a lot of things out there, even those designer drugs like, ecstasy or whatever. So there is a lot of them, a lot of products out there. But when this boy came, the first thing we do is to look in his eyes. Because overall, the substance that is out there are classified as those who are stimulant, they stimulate the nervous system, and those who are downers. So any clinician, a specialist, cannot be somebody who has not been trained for this to deal with this, because you can complicate things and you can cause the patient even to die if you don't know what you're dealing with. So it's a very sensitive topic, and it requires somebody who has experience with such a thing and dealt with those things before and knows what he's doing, for the reasons that I will explain to you a bit later. So when the patient came in, the first thing I look at his eye. I open his eye, I flash a light into his eye, and then I already know what kind of material he's in, whether he's actually in intoxication or in withdrawal. Because those patients come in two types of scenarios, or maybe a third scenario. One is acute intoxication. He took something, okay? So that is intoxication, acute intoxication. And sometimes they come in with withdrawal symptoms, meaning that's something that he is used to take, he cannot take for some reason, and then the mind sets on the symptoms of withdrawal. And then another third scenario, they come in with overdose. They took too much of that substance, he's already on overdose. Now, different material, different substance cause different signs and symptoms, and also an abuse or intoxication of one substance can kill. An intoxication of another substance not necessarily can kill. So, upon looking at this patient, I already know he is in acute intoxication, possible overdose with something that stimulates the nervous system. The stimulant for the nervous system, the mother of all, is called cocaine. Right. Cocaine has been used since 1800s. They used it before as an anesthetic. Because what? Because it causes vasoconstriction, and it can cause numbness, and it can cause loss of sensation of pain. This is what they used it before in the 1800s. Now, over the years, they found out that this substance actually, when you take it, when you inhale it, because they sniff it by the nose, or they can make it, turn it into a solid material by adding specific chemicals, and that now they burn it and they call it crack. They find out when you take this substance, it causes euphoria. It causes you being happy, sensation of being happy. And also, like you can do everything. So grandiosity. And, you are number one. You're on the top of the world. You can do anything you want. That is grandiosity. It causes euphoria, severe euphoria, for the reason that we will discuss later, for the pathophysiology and the biomolecular basis. When you take cocaine, what happened exactly in your body when you took cocaine? This is what we will discuss. So this patient, I looked into his eye, and the eye is constricted. The pupil of the eye is constricted, but yet reactive to light. Reactive to light means when I put the light, it constricts further. When I move the light, it dilates a bit more. So that's what we call reactive to light. But there is there is pupil constriction, and the patient is really in severe agitation, in seizure. He does not know what's going on around him. He's kicking everybody, beating everybody. He is in very bad case. So when we took the vital signs for this patient, guess what? His blood pressure is sky high. The blood pressure is very high. When we took the heart rate, is very high. When we took the oxygenation, is about 95, so it's a bit normal. But we have a concern. I already know the minute I looked into this patient eye that he is on CNS stimulant. Could be amphetamine, could be cocaine, could be any of those substances that causes stimulation of the nervous system. So in this case, I know most likely we are dealing with crack. And now let me tell you about the crack here, or the cocaine here in Cameroon. It is not like the cocaine in the United States. That's for sure. The cocaine in the United States is original, is pure. The ones that is here is laced with chemical, probably Chinese version of it, laced with chemicals and toxic material that we do not know where it's coming from, that can cause permanent brain damage. So because cheap, for very small money, you can get crack. You cannot touch crack for less than $20 in the United States. And that is about, what, 10,000, all right? So here, you get crack for 500 francs. I don't know what kind of crack is that. So definitely is not pure cocaine. Definitely is a synthetic. Synthetic means they have made it in the basement somewhere, in the bushes somewhere, something to stimulate the central nervous system. So, but overall, anything that stimulates the central nervous system will manifest the same, which is the pupil will be constricted in case of acute intoxication. But this guy didn't just come with acute intoxication. This guy came in with overdose. Overdose meaning he has taken a lot of it. So that's a case that is very much emergency. That's a case that is very much emergency. As you can see, he has the same manifestation or even worse upon admission. When we took him to the floor, he still manifested the same. Now I have to keep in mind that this is something that has to be handled by somebody who knows drugs intoxication. Because what? Because this patient can die at any moment. and we're going to tell you why. One of the things that cocaine causes is something called vasoconstriction. Vasoconstriction meaning it makes the vessels, the blood vessels, especially the artery, constrict, meaning narrow down, very narrow. Among those arteries, we have the coronary arteries that feeds the heart. The heart also gets arteries that feeds them with blood to be able to work. So if I constrict all the arterial blood, the arterial vessels, the arteries, if I constrict the arteries, and among the arteries I also constrict the coronary arteries, we get two things going. First of all, if I constrict all the arteries, that's what will that do to the blood pressure? The blood pressure will definitely be high, because instead of a vessel that diameter, I constrict it to be, half size, half diameter, the blood pressure will rise. And that is exactly what the patient presented with. What else can happen? Well, when I constrict the coronary arteries that give blood to the heart will have ischemia. The heart will have ischemia, and that can lead to myocardial infarction, MI, cardiac arrest, a dead spot in the heart, myocardial infarction, MI. So that is two things that can put this patient at very bad crisis. Two things, which number one is the very high increase in blood pressure. Also the heart rate can go up because the cocaine can cause arrhythmia. And then third, the heart can now go into ischemia. Let's take a break and we'll continue with the bad things that cocaine intoxication can do to you.
Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in two cities, Boya at mile 18 Bulifamba, and in Douala, we are located at Entrepilor. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
You're welcome back. So we've spoken about the bad things that cocaine can do to you. Crack. Usually they smoke it mixed with marijuana. Marijuana is a downer. The crack is a stimulant. So they kind of mix both of them together. Nevertheless, when we took the blood pressure for this patient, it was high. When we checked the heart rate for this patient, it was high. We were supposed to be ECG. We were supposed to do ECG to find out, because the cocaine causes widening of the QRS, meaning it can put the heart down. It can cause heart failure. And that you see on ECG of that patient. I said, those are very low socioeconomic class patients. They don't have anything. So we rely basically on our clinical experience. We have to do a couple of tests. Those are the very necessary tests. And then we decide what we're going to do with the patient, how to save the life of the patient. So this patient will die of what? This patient, if he will die of cardiovascular complication. Cardiovascular complication, we said the heart. The heart, we have widening of the QRS, which meaning the heart is at risk for heart failure. The heart also, because of the tying and the spasm, the narrowing of the vessel leading to the heart, we can have myocardial infarction. We can have ischemia to the heart. So the measures that has to be taken is first, save that patient life, lower the pressure by at least 25% of the value that he came in with. So if he came in with diastolic of 150, we have to bring him to about 100. Diastolic of 100. We care most about diastolic pressure because diastolic pressure is the reflection of the arterial pressure. And we said the cocaine is the one that causes vasospasm, especially arterial spasm, meaning narrowing of the arteries. Then the next thing we have to do is what? We have to save this patient's life from cardiac infarction. myocardial infarction. So we're gonna give something called nitroglycerin sublingual. This is the doctor will do that to make sure those vessels relax. We'll have to give another IV medication to quickly control the pressure, and but not to drop the pressure more than 25%. We reach about 100, 105 diastolic, and that is the target. Now we save the patient as far as the cardiac. Now, but this is not the only thing cocaine does. Cocaine is a multi-system damage. But the most important three systems are: number one, the heart; number two, the central nervous system. So the central nervous system, what cocaine does is make you happy, make you paranoid. Paranoid, but okay, the patient will accept the paranoia in exchange for the euphoria, the grandiosity. He is feeling big because he is nothing in real life. So he goes to cocaine to make himself more important. Yeah, obviously it's for a specific hours or so, and then you suffer the intoxication, but the sense of grandiosity is so nice to them, to those who use cocaine. Now also it has another thing that the patients or those addicted patients go and use, is the sense of control. When you take cocaine, you feel control, and also you feel a little bit focus. That is why some of the surgeons in United States, but they take control dose, they take cocaine before they go to do the surgeries. Is it okay? No, it's not okay. Because one dose, small dose today, will turn into addiction tomorrow. So, but I'm just telling you what is going on, because doctors also use cocaine, especially surgeons, to keep them focused. Is a bad thing? It is a bad thing. Is this doctor should be dismissed? Should be dismissed. Because you cannot be using drugs while you a medical doctor. But they use controlled dose, but you can never say controlled dose, because as I said, it starts small and it gets big. So there is nobody immune. So I told you, so the highest socioeconomic class doctors use it, the lower socioeconomic class, that is this patient, as this patient came in, they also use it. So now we have to think about something together. Why did those guys, the doctor in that high economic class, the patient that is a farmer from the lower socioeconomic class, why they go and use cocaine or any substance for that matter, but let's focus on cocaine. The fact of the matter is there are triggers. There are triggers that want to make you go and do that. So there is something in your life that is stressing you out, that you want to escape even for a small amount of time, so you lose your mind to get away from this problem facing you. So this is what we call the triggers. As a physician, as a treating physician, you have to find out what is the triggers. So we do what is called hypnotic therapy, hypnotic psychotherapy, to find out deep in the brain what is the problem. Why are you going to alcohol, cocaine, heroin, whatever it is, to get away from what exactly? And that is the cause of the issue, the triggers. We must find out what trigger him to go and use this substance. So this is very important for us to do. Now, those patients, unfortunately, all share the same story. They used to have family, now they don't. The family is there, but they cannot do anything for the family, because all they think about is what? Is the drug. If we talk about cocaine, all they think about is cocaine. All they talk about is cocaine. All their life is centered around cocaine. There is nothing else he sees except cocaine. If his money is finished, he will steal from his own mother, his own father, his own family, because all he needs is his dose. So there is nothing going on in his life. He is not functioning in life anymore. He is the living dead. The only concern he has is the substance that he needs to take in, whether cocaine, whether a downer or a stimulator. Okay? So their life is screwed up. They have no life. And the sad thing is, they lost their life to drugs, but also the family around them suffers. And you can imagine the suffering for this patient that came in. Who brought him in? His mother, his father, and a couple of brothers. Who are these? Those are the family. So who's suffering? The family. Who's enjoying the drug? The patient. Now, does the story stop here? No. It's a lot more to it. Those patients will not realize what they are doing, and they will not really stop only in one condition, which is they'll have to hit bottom. When I say they have to hit bottom, meaning they lose everything. They lose everything. Family, house, money, job, everything. I got this patient and he said that he's so much on that smoke that sometimes he doesn't have a house because that's another patient. He smokes one in the back of another, one in the back of another, that he doesn't even recover. He doesn't recover. He's always back to back, till he knocks himself out and he sleeps wherever he is. That could be the bushes, that could be the street, that could be here, that could be there. So he knocks himself out or herself out to the point that they don't even go home. They sleep right there in the street. They sleep right there in the street. So if you want to treat those patients, we have to talk about self-determination, meaning that patient has to be determined to cure themselves. And what does that mean? It means that if I take a patient for drug addiction and I admit him for a week, 2, 3, 4, till I detox everything out of his body, does that mean he's cured and that's it? He's a good member of the society and he will not go back to it? No. 50% of the cases relapse. After we treat addiction, the patient goes out there and he relapses. He sees his old friends, he take a joint, 2, 3, he's back into business again. So those patients to be treated, really, what I have seen, those patients to be treated is when they realize they are at the bottom. They don't even have a home to sleep. Like this patient telling me, I don't even have a home. The home is there, but he cannot make it to the house because he's always smoking back to back, and when he gets knocked out, he sleeps wherever he is. You see? So that is the issue. When they realize they are at the bottom and there is nothing else lower than the bottom, they will wake up. Some of them will wake up and they will come themselves and seek treatment. Doc, I'm tired of it. I want to get rid of it. Can you help? Yes. Because they already have seen what it does to them. They already have seen what it does to them. We have not finished talking about the complication of somebody intoxicated with cocaine. We said the brain, the good thing, or what they think is the good thing about cocaine is we have the euphoria, we have the grandiosity feeling, but sometimes it comes to the point of psychosis. So we have to treat them as a mad person. Dopamine is too high in those patients. We have somehow to lower dopamine, the same way we do with psychotic patients. Okay? Also, we have to remember that in those patients, cocaine causes a lot of release of something called norepinephrine or noradrenaline. So norepinephrine is high. So we have a constricted vessels. We have norepinephrine that is very high. Both of them lead to very high blood pressure, and that is the problem. The very high blood pressure that can blow a vessel and cause a stroke. Nevertheless, talking about stroke, cocaine in itself is also an enhancer to form clots, thrombosis, thrombus, a clot. So that's an invitation for a stroke. So this patient has to be dealt with very seriously, and you have to know what you're doing. So first step, we have to lower the blood pressure. Second step, We have to make sure the heart is good. Third thing, we have to give an anticoagulant or something to prevent any stroke from happening or any thrombosis from taking place. Now, it's not only that. Now, don't forget, this patient's having seizures. What you seen in the video before, that was a seizure. That was an answer to a seizure right there. And the patient, we're going to see the video later on, the patient after recovery, he does not remember that we showed him the video. Do you remember this? He does not remember anything of it. So that was a seizure induced by cocaine. We have to stabilize his brain by giving some medication as well, so it doesn't continue. Let's take another break, and we'll continue after the break, inshallah.
Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Welcome back. So that is the patient. And that is what we have gone through with this patient. First, we stabilized the heart. It's very important. The breathing was okay. And we have to take care of him according to the complication he's shown, but we have to be very fast, because when we took the sodium level in this patient, the sodium level was about 200 something. You know, one thing about, if you want to understand how can cocaine does all that, only if you understood one thing cocaine does, you will understand how can cocaine do all this damage. Cocaine blocks the sodium channels. The sodium channels in your body. That's all over your body. You know, I don't want to get too medical and too technical, and for the audience out there not to be difficult to understand. But we have, we don't have wires go from the brain to the rest of the organs. We have, chemicals like sodium. That this is the most common intracellular ion that goes inside the cells based on concentration gradient. And then we have the potassium, that is the most abundant extracellular outside the cells. Is the exchange of those sodium and potassium, one goes in, one goes out, that what we create something called action potential with the help of something called ATPase enzyme. This is all technical, forget about it. But what I'm trying to tell you is this: the propagation of the signals coming from the brain to all different organs is controlled by that sodium channel, let's say. So if I have this cocaine manipulating these sodium channels and blocking it, we have really interfered with all the signals going from the brain to the rest of the organs. So this cocaine that you're smoking out there can cause multi-system malfunction, because the signal that is relying on the influx of sodium through its channel has been blocked by this cocaine. So when we took the guy's sodium, it was very high, because it's not going inside the cells anymore, it's remaining outside in the blood. So you can measure now, can we get pulmonary damage from this guy that is using cocaine? Yes. First of all, simply because he's smoking, and that thing is not really good, so it causes ulceration in the airway, but nevertheless, this is not a problem. We can deal with that. It's not going to kill you. But what's going to kill you is a thrombus, is a clot in the lungs. And we said, cocaine causes vasoconstriction for the same reason about the sodium channels. So if we have vasoconstriction in the lungs, in the vessels of the lungs, and we know cocaine can cause thrombosis, which is small clots that can launch in the lungs, we have pulmonary embolism that can definitely kill you. So those are things that has to be taken in consideration when you're dealing with somebody with acute intoxication or possibly overdose, that when it comes to the hospital. We have to take in mind, we have to keep in mind that we cannot have this guy forming clots, number one. We cannot have this guy go into a heart attack, that's number two. We cannot have this guy going very high blood pressure to blow a capillary in the brain, that's number three. Yeah, talking about capillary in the brain, those guys can get also intracranial hemorrhage, bleeding inside the brain. All this can happen because of cocaine. All this can happen because of cocaine. You can die with an overdose or acute intoxication of cocaine. Can amphetamine do the same thing? Yes. Any CNS stimulant, there are degrees. What kills you the most is cocaine. You cannot calculate the dose, and those people who give you those drugs, they don't know how much they put in there. One batch could have a high dose, one batch could have a lower dose. They're not pharmaceutical companies to calculate, okay, this smoke has such and such milligram, and this package here has such and such milligram. They back it anyway. And we don't even know what's inside there. We don't stimulate the CNS, and they claim it to be cocaine crack, but who knows? Who knows? Is it natural? Anyway, the best way is to stay out of it. Stay away from it. It causes you hazard to your health. It will kill you. How many people have you heard of died of overdose? How many? A lot. A lot. So overdose can kill you definitely. Especially if you don't have the right medical facility around. And especially if, they die. Believe me, they die. If you don't have the appropriate immediate care, you die. So the best thing is, when you know you have a problem with addiction, the craving, meaning I want the dose, is so strong that overcome everything. Like I said earlier, those patients live for the drugs. All their life is centered about the drugs. They breathe the drug. They woke up in the morning talking about the drugs. They go to their friends, they only talk about drugs. He only hang out with those who take the drugs. Everything to them is about the drugs. Everything in their life is centered about the drug. I'm going to go this place because I'm going to find the drug. I cannot go to that place because there is no drugs there. So all their life now is controlled by the availability of the drugs. All their future is centered about the drugs and how much they're going to use the drugs. So who controlled their life? The drugs. And so now they are like a remote control. The drugs is everything in their life. Meanwhile, the family is suffering. Financially, emotionally, everything. So when you have a drug addict in the house, I feel for you, because that's a total destruction, not only to the person himself, but to the family also. And the community. And the whole society after that. So we cannot have this kind of patients, and all of them are young people, very young. This guy was 20-something. He is not the only case that I have seen. I see many, but I just would like to I share this with you so you can see. We stabilize the patient. We give the patient the appropriate medication. 4 or 5 days later, the patient was fine. And here is the video after 5 days of admission. I let him go after a week or so on follow-up, to come and follow up every 1 week. The detox process took us about 5 days. And let's look at the patient after recovery. Now, he's talking. Everything is okay. Do you remember anything of what happened to you? Do you remember the attacks you went through? Do you remember the compulsions that you had, and the aggression and the fighting and want to kill everybody? Do you remember? No, I don't remember. No. He's a nice boy now. Very nice gentleman. Okay, boss, you understood the situation? Mommy, you understood the situation? So you're smiling now. She was crying for you, right?
Yeah, mommy was crying.
She was crying.
Every day, Ashia mommy, Ashia mommy.
Well, thank God. Alhamdulillah. So he's a different person. Remember, he was not talking. He was just fighting. Okay, he was not talking. Now he talks. Now he's a different person. Totally different person. And when he came in, he refused to take medication. 10 people have to hold him down to give him an injection, and he refused to open his mouth. So how are you going to lower somebody's like this pressure? We have to revert to IV under force. We have to give him the IV to lower the pressure. We have to give him. So it was a difficult case at the beginning, but things has to be done to secure the patient and save the patient. And we thank God, above all, that the patient was saved. And a few days later, he's back home. You know, and I hope I don't see him again in this scenario. He learned a lesson, you know. I mean, he was not in his conscious when he did what he did. And when I ask him, do you remember any of this? He doesn't. He doesn't remember any of it. All right, so this was a nice ending for somebody who got immediate treatment, and he recovered, and he went home. So that's a nice thing. Now, not only guys go on medication, also ladies. And like I said, everything in their life is about the drug. So if you get a lady and she get pregnant, and she is on even an alcohol or heroin or any substance that she's abusing, you know, guess what? The newborn also, the baby inside, isn't the same substance. Even if she's taking alcohol. You know, some mothers do, because they cannot live without being on this substance, whatever they're abusing. So at the time of delivery, the baby, you know, after delivery, you know, he will go through irritability, seizures, you know, drooling, you know, what is this, what's going on? So then when you realize, if you're a smart doctor and you've seen cases like that, you know this baby is going through withdrawal symptoms. Why? Because the mother was taking something, she was addicted into something, she was depending on a substance, and now this substance, when she takes, it's in her system. And then whatever the mother takes, the baby also takes through the placenta. So now the mother is abusing a substance, but at the same time, the substance is getting to the baby. So now we have an addicted baby inside the uterus. So now when the baby is delivered, he is no longer getting that substance because the baby cannot smoke. So now, what happened to the baby? The baby goes through something called withdrawal symptoms. We cut the substance that the baby system was used to. He's no longer getting this substance, so he goes through signs and symptoms. Some of it could be severe and very bad. So this is also a price that a baby that just came to life, he starts to suffer because of the addicted mother. You see, so it's a bad thing. No matter how you look at it, it's something that is very bad, and something that I want everybody out there to think about twice before taking that joint, or smoking that, or sniffing, or shooting. Think about it twice. The complication is very bad. It can lead to your death. And we heard about a lot of people that have died from overdose. Let's take one more break, and then we're going to talk about another subject.
Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bulifamba, and in Douala, we are located at Entre Pilor. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
I want to share with you something that is very nice for all the patients out there that may have kidney problems. You know, the kidney is a very important organ in your body. The function of the kidney is to filter out the blood. The blood goes through the kidney and the kidney filters out. Anything that shouldn't be in the blood, the kidney is the main organ to filter out that blood. And we, in medicine, we have something called creatinine urea. Okay, and this is our way to know the kidney profile, whether the kidney is good or bad. We measure something called creatinine and something called urea. The normal value is 1.2 to 1.5, I may accept. From 0.8 to 1.2, 1.3 is okay. It's a good kidney. So there is calculation that has to be done, but to make the story short, if someone comes in with a creatinine of 2, we know the kidney is at about 50% functioning. How about come with 3, about 75% functioning. Creatinine of 4, the kidney is no longer functioning. It's very low. Kidney profile functioning is very low. So we rely quickly on, we look at the creatinine value, and then we decide how much functioning the kidney, the kidney is doing. So the kidney diseases is, we categorize them as, we call it pre-renal, or a problem in the kidney itself, or something that is happening after the kidney. After the kidney, there are the vascular system and everything else. So we have pre-renal, we have renal, and we have post-renal. The most common cause for kidney injury is the pre-renal. You're not drinking enough, you're dehydrated, so things like this can hurt the kidney. And that's an easy fix. Then we have kidneys problem like necrosis, tubular necrosis, or so many names. Anyway, all those could be looked at, with the creatinine value. We know there is a problem at the level of the kidney. I want to share with you something that I have discovered and note during all these years of practice. I have patients that came with creatinine 3. I give them this product. I want to share with you. It's a gum. We can put the picture of that last image. Will be great. So it's a gum. It's frankincense gum mixed with Arabic gum and other natural herbs. This 2 bottles, he makes it like a tea and takes it, and after 1 week to 2 weeks, the creatinine value is back to normal. And this patient, his creatinine value was 3.7. That means very small of the kidney is functioning. After 1 week of taking this gum, the kidney is back to normal. There is a lot of studies that was done proving that Arabic gum mixed with frankincense gum and a couple of other herbs are very, very good for the kidney, and it reverses the damage of the kidney. But what if the creatinine is 20, 25, 30? That's no. This can lower it small, but it will not. It will not reverse the kidney function. Then in this case, we will have to send the patient to a nephrologist, and dialysis, kidney dialysis, is the most likely thing to be done for these patients. So as long as the creatinine up to 4, we can do it very successfully, without a doubt. It works. When the creatinine shoot 50, 60, 70, that's dialysis right there. It can lower it, but we need to bring it back to 1, 1.5. And this natural treatment will not bring it back to 1.5 from all the way from 60, 70. 60, 70, that's dialysis, especially if there is abnormality with the potassium. Okay, so the kidney does a very important thing in retaining potassium level normal in the blood. So when potassium level starts to be abnormal, we have a problem. When creatinine starts to show 40, 50, 60, that's very bad. So that we have to consult with a nephrologist, and we have to consider kidney dialysis. Why I'm talking about that? From drug addiction to kidney dialysis. Why am I talking about that? Because I get patients, young patients, that they are taking this natural, they call it traditional medicine, for God knows what. She cannot get pregnant, traditional medicine. She has hepatitis, traditional medicine. Her husband is mad at her, traditional medicine. She gets a spiritual attack, traditional medicine. Everything you take. And they end up with very bad kidney. Young. They're already going into dialysis. I said it before, and I say it again. Before you put something in your mouth, ask what is this? What am I putting in my mouth? And everybody has phones now, and you have Google. Google it now, see what it does for you. But if the seller himself doesn't know what he has inside, you have a problem. You're destroying your health. And we said so many examples, and there's so many sad stories about young boys and girls going into kidney dialysis at very young age. You know what kidney dialysis means? A machine will work as a kidney for you. And you have to be doing at least 3 times in a week. They take one blood supply from here, maybe from here, big one, so they can hook up the machine, and then you sit there for like few hours for the machine to filter out the blood. So that means you are bound to that area where the hospital is that has dialysis. You cannot go anywhere for more than a day or 2 because you have to come back for the dialysis. Because if you don't, you're at risk, very high risk for losing your life. What do you want to do that? Prevention then is much easier than going through kidney dialysis. So before you put something in your mouth, know what you're putting in your mouth. Before you go for traditional medicine, it worked for this guy, and they have their own stories. Hey, those are hustlers. They have their own story behind everything. Their only concern is to make some money from you. Whether you live or die is not their business. Whether you get sick or not is not their business. All their concern is money. So they have a story behind everything. This guy got it and he's good now, and this girl got it and she's good now. Everybody that comes in with hepatitis, they tell me they're taking traditional treatment. We test for the surface antigen, it's there. So what is the traditional treatment did for you? I challenge anybody out there that took traditional treatment for hepatitis and got cured. Bring them to me. I think we're reaching the end of the session today. I thank you all for listening. God bless you all. And I hope you do the advices that I have shared with you this evening. And I will see you next session. You have a beautiful evening. And God bless you all. Thank you very much.